Hi, this is Katie Brummer with Nursing 406 Leadership and Management Interview. Wes, when you're ready.
Tell me about yourself and why you feel you are qualified for this management position.
With over 7 years of clinical experience, I think that I have a track record for positive results and the qualifications that are required to help contribute to your organization's growth and goals. I have had 2 years in the cardiothoracic step down unit at Duke University, followed by 2 more years in the medical intensive care unit. And I have currently been a clinical research coordinator at Duke Raleigh Cancer Center for a little over 3 years now. And with all of these jobs, I have had a great amount of opportunity and growth to continue to develop myself as a professional. With my experience on the floor in the ICU and in the cardiothoracic unit, I precepted over 10 nurses during my time there because my supervisors preferred me to do the precepting because of my positive attitude and my love for education and my love for the nursing profession. In the past 3 years in the cancer center, I've had the opportunity to be a clinical lead, which means that I oversee studies and help do startups for the studies from the ground up, working on getting the protocols and everything needed to get the study rolling and working with doctors. So I also, with that being said, I also have a great amount of experience of working with physicians and working with, you know, uh, different people in the healthcare setting, not only just patients and patient family members, but I work well with all of the different disciplines within the healthcare setting. And I work well with others. So I think that, my experience over the past 7 years has helped prepare me for a position like this where I'm ready to take on a management um, and leadership role. So, and also, I'd like to include that I have been working on my Bachelor's of Science, and I hope to achieve my Master's in Nursing Education at some point. I feel that education is a huge part, especially for nurses. I think that we have to continue working on our education, and I think that that's a huge part of our role and growth in this career. And so it's very important and near and dear to me to continue to achieve that. So,
What is your style of leadership? What style do you prefer your supervisors to display and why?
my style of leadership would have to be a democratic style. Um, I think that that's because I truly identify with leaders who take a hands on approach with their employees and are active listeners. I think that being an active listener is a huge part to any successful manager because it opens up the lines of communication. Um, you want to be the type of leader that has an open door policy where your employees feel like they can come to you at any time, where they feel like they can approach you and that they can talk to you and that you're actually listening to the concerns and not only listening, but that you're going to act on them. I think that's another huge part as well. And a democratic leader definitely fits this mold in which that I'm explaining to you. And I also work well with managers who have this style of leadership, and that's what I prefer is to work under someone who has a democratic style of leadership because I feel like it's important to build these to build this level of trust, especially in the nursing profession. It's extremely important to be able to continue to have open lines of communication, to build the trust with your employees, and to make a working, cohesive team. Um, and that all starts with the kind of leader that you are. And if you are, open and listening and, communicate well, then you're going to have a successful team because those people are going to want to work with you and they're going to want to build with you and they're going to see the vision as not just your vision, they're going to see it as their own vision. So that's what I identify with.
Describe the core values that are most important to you and why.
I'd have to say my two most important core values are family and religion. And which I think that it ties well in with the ANA Code of Ethics, which the Code of Ethics speaks about how nurses are responsible for protecting the rights of and the health and the safety of their patients. And if you hear me out on this, I'm going to connect it all. But so as a nurse, that's what you're responsible for doing is acting as an advocate for your patients. For me, I look to my patients as they're one of their family to me. That helps for me to see past maybe any differences that might set us apart on the outside walls of the hospital. But when my patient's in that bed, I like to look at them like, they are a grandparent or an aunt, an uncle to me. And that way I'm able to truly, do everything possible to take care of them because my core values, family and religion being so important to me, I would do anything for one of my family members. And that's why I like to look at my patients as part of my family, if you will, because I'm going to do anything possible to take care of them. And, for all hospitals, what is the number one goal? It's patient care and patient safety. And I think that this, looking at my patients as one of my family members, resonates deeply with me. I'm going to do everything possible to make sure that they're taken care of. And so it helps for me to be a better care provider and ultimately hitting the goal of the hospital, which is that patient care and safety.
Give an example of a model of care that you believe is effective in delivering high quality, fiscally responsible care.
I think that the model of care that best represents being able to give effective, high quality, fiscally responsible care would be the modern theory. With the democratic style that I spoke about earlier and that I identify with, I think that the modern theory works well with the democratic style. The concept of a modern team working together to solve complex problems, along with the idea of organizational learning, draws me to this type of management. And with this type of management, it encourages everyone to have their voice heard and to work towards the goal of delivering high quality care. And with that being said, not only high quality care, but also, fiscally responsible care. I think that the two of them can go hand in hand together because, you want to stress to your nurses that you want to give your patient the best care possible, but you also don't want to be wasteful in your resources either. You want to make smart decisions, smart, effective decisions that are going to help take care of the patients, but also be fiscally responsible.
List 3 skills that you feel are most important for managers to use when leading an interdisciplinary team. To what extent do you possess these skills?
3 skills I think that I feel are most important for managers to use especially when leading interdisciplinary teams, would have to be organization, directing, and coordinating. I personally use all 3 of these skills on a daily basis. As I spoke earlier, I am a clinical team lead for several of the clinical trials that we are currently running. And that requires me to be organized in that these studies are very thorough. They have a lot of different facets and points to them, and it requires me to have to be organized. I have to be able to break these studies down and be able to follow through each part of the protocols. Um, Also, with directing, I have to be able to direct team members to do different, to be able to implement certain parts of the protocol, whether that be, you know, tissue samples, blood samples. I need to be able to be thorough and organized in knowledge of the protocol to be able to implement what needs to be done, to be able to direct the others, to know how to uh, effectively follow the protocols and what is required of us. And then also, I have to also coordinate, do a lot of coordinating, which that more applies to coordinating of patient care and making sure that my patients are getting what they need to get done, whether that be, planning for them to have the tissue biopsy taken, x-rays, MRIs, lab samples, their appointments, and the list goes on. And so all three of those skills are something that I have to work with daily, to make sure and achieve that these clinical trials are being followed and taken care of like they need to. Now, speaking onto a more broader spectrum and how this plays into the interdisciplinary team, I also work with my oncologist, the radiation oncologist, the um, surgical oncologist. I work with radiation techs. I work with all these different parts of the team, nutritionists, and it's important not only to maintain, our goal, which is patient care, but also that the goal of the nursing staff is being met and being heard. And I think that I do an excellent job in being able to stand up for what needs to be accomplished, speaking from the nursing end of this. And I think when you're working in an interdisciplinary team, you've got many players, and sometimes egos or can get in the way of things, but I am able to do a great job of making sure that my voice is heard and that my wants and concerns for my patient, or for the nursing staff are being heard, and being able to say, you know what, we are not able to do this, or yes, we can do this, or maybe we should think about this. I have no problems with being able to truly voice and advocate for others, which I think that's important, especially working in interdisciplinary teams. And with a job like being a manager of a unit, I am going to have to work with, not only the staff, but physicians, other people that work on the unit, and also my management. And I have no problem with being able to work with others, but also, to make sure that I stay true to what's important, which is I would be an advocate for my nursing staff. And, I understand that. And I think that I would do a good job of ensuring that I was that advocate for the nursing staff.
What management skills are you lacking? What is your plan for developing these skills?
I'd have to say, for as far as management skills that are lacking, um, it it would probably be delegation is something that I struggle with. And I think that the where I come into a problem with delegation is that it's not so much that, oh, nobody else can do this job except for me. I don't really have that mentality. It's more that I was hired for this job. They expect me to do this job. I'm the one who needs to get it done. And oftentimes in nursing, that's impossible. You need to be able to prioritize what's the most important, what you can get accomplished, and sometimes you have to ask for help. And working side by side in the unit, I would sometimes find myself getting burnt out because I was running around like a chicken without their head, because I was trying so hard to get everything done and I didn't want to ask people for help. And I soon realized that that just was not an efficient way to accomplish my tasks for the day, nor was it good for my patients. And also, it was important because you need to be able to rely on others at times and to help people out, and to ask for help from others. I really had to learn how to delegate when I went on maternity leave because I really had to hand over my patients to someone else. And it wasn't just so much of like, hey, could you help me out for today? It was, you're going to need to help cover me for 12 weeks. That learning experience really helped me to see that I have to be able to trust my team members. I have to be able to know that they're going to take care of and they're completely capable of taking care of my patients. So, with that being said, a plan to help develop these skills is that I think the first thing is being self aware that this is something that I need to work on. And that's the first step in any process of, making a difference and improving is acknowledging that you have a problem with it. So, um, knowing that I need to work on delegating. And then as a manager, I know that there are going to be times where I'm going to have to delegate, but I think the important thing is to make a list, see what needs to be accomplished, and what are the best things that I could possibly take off my plate to give to others. So that way I could focus on maybe the bigger or the problems that might be more time consuming or require someone, um, you know, with my level of expertise to have to be able to look at to accomplish. So, but I think that that would be my plan of helping to improve with being able to delegate.
In what ways are planning and budgeting related? What factors would you consider when planning the budget?
Well, I think that if I was the manager in charge of the fiscal resources, I would use my 7 years of nursing experience to help estimate realistic performance goals. I would also take the time to work with the fiscal management department to truly understand where numbers come from and how they are generated. Um, I think that there is a strong disconnect between management and accounting, and therefore, to understand the budget components is essential, especially when it comes to defending necessary changes. Um, Assuming this role would require the knowledge of how budgets work. So, the factors for planning a budget, I would, to begin, review the past performance. I would review the organization's goals and projections for this upcoming year. I would have to review the variance, and I'd also have to, prep the budget for the new year. I also would want to look at, as being the manager, you'd be responsible for looking at the personal budget, the supply budget, and then also the capital budget. So, you know, understanding and knowing that I would have to work on all of these areas would definitely take a lot of time and effort. But more importantly, I think that being the first time being a manager in this role, working with my supervisor and also being open and working with the accounting team as well to help plan and implement a realistic and feasible budget for the upcoming year would all be important and part of my overall, plan of attack, if you will, for accomplishing this. Because, with any budget, the planning begins a year in advance. And waiting to the last minute to try to accomplish a budget is not feasible or possible. So I think that, as soon as I assume the job, that's when preparations would begin for reviewing the budget and seeing where we stand and, okay, where do we go from here? How do we maybe improve from last year? What things can be fixed, what worked, what didn't work, looking over maybe the past several years to kind of get an idea of maybe was there something that was implemented right before I came on that did work or didn't work, and also working with my manager, like I said, in accounting, to also be able to get an idea of how we could plan for the future a to make the budget work.
Let's assume that you are hired into this position and that the budgeting process has already been completed by the previous manager. You notice that the budget does not include enough money to cover staffing expenses for 3 months of the fiscal year. What steps would you take?
Well, to begin with, I obviously I would thoroughly review the budget, and then I would go to my manager, and I would sit down with them and discuss this problem. And I would explain to them that the budget is not complete, and I need to come up with a solution to fix this. Um, I would ask to see if there's any more money in the budget that we could possibly be able to use, or if there's any money, elsewhere that we would be able to pull into the budget, so that way we'd be able to make it stretch for those 3 months that we're lacking. And if that's not possible, then new ideas of how we'd be able to get that money would need to be developed. So, looking at PRN positions, part-time positions. Are these really necessary? Do we need to have them? Is this something that we can do without and just use our full-time staff instead? If we were to get rid of PRN and part-time, do we have enough staff that would be able to cover, or staff that would be willing to work those overtime shifts that would cover, our PRN and part-time loss of staff? You know, would those savings end up benefiting us and being able to stretch over the next 3 months? I mean, that's something to consider and look at. I would also want to look at, is there any other way for us to perhaps maybe hold off on hiring new staff, especially new graduate nurses? That's a huge cost in the education and getting them implemented and up to speed on the unit. Even though maybe their pay is less, their actual cost for enrolling them is huge for hospitals. So, looking at different possible options that we could work with to try and make up for this deficit, because obviously, I mean, you don't want to cut staff, especially surrounding, budget cuts. I think that sends a really harsh message to the staff that are there. It makes them worried and concerned about their job safety. So if there's any way possible that we could get around not cutting actual jobs, I think that would be my main goal, without a doubt. However, if that doesn't work, then I would start with the PRN before even touching the full-time, staff, because I think once you go there, then that really just sets a tone that's, I think, kind of difficult to recover from, especially being a new manager and stepping in. I don't think that would be really the team spirit or tone in which that I would be going for my team. So,
how would you describe your level of emotional intelligence? Give 2 examples of how your emotional intelligence has positively impacted a group or team.
I would describe my level of emotional intelligence as high, that I have a high emotional intelligence. And I, people who fall into this category, it's said that they make others feel good, that they go through life more easily because they have this positive outlook on life, and they have a more of a go with the flow attitude versus, everything's negative. I hate this, or I don't want to do this. I'm the complete opposite. I like working with others. I enjoy a team atmosphere, and I enjoy being positive, and I enjoy building others up. I work, like I said, I love working in a team atmosphere and working with others for a common good. And I think my first example of that would is um, a great way to show you how that I do enjoy working with others. We recently hired a new employee to our team who we thought was going to be a great addition and outgoing, or so it seemed on the interview. And then when they were hired, um, they very much like to keep to themselves. They didn't want to involve themselves with others. And slowly but surely, there ended up being a bit of a divide that started between the employees. And it really started to affect the team atmosphere and everyone's attitude at work. Where it was once everyone was coming in and saying, hello, good morning, how are you? How was this? How was this? People just came and sat at their desks. And if people had questions, they weren't asking each other. The team was no longer engaging with one another. And, looking back on this experience, it's absolutely amazing how one, if you will, bad apple truly, that attitude just really just grew like wildfire amongst the staff. But it got to the point where it was just so bad that I personally just was like, there needs to be something done about this. Like this tide needs to be turned. So I went to my manager and I said, we need to do something about this. Can we maybe do some team building exercises? What can we do that'll help bring everyone together? Some icebreakers. We need to do something that'll kind of reset the clock, if you will. And she agreed, and we looked at the calendar and found 2 afternoons that didn't have a lot of heavy patient load. And we all went to one of the conference rooms and we did ice breaking and team building activities, which at first, I mean, it might seem silly. And, most people kind of are like, oh, team building, like who likes to do that? But it ended up, we were able to reset the tone for everyone. And this one employee kind of forced them to step a little bit outside their shell. And all of a sudden now we're laughing and working together and starting to build that bridge, if you will, between one another again. And it really helped us reset the tone for the office. And after that, we also started implementing, twice a month, everyone eats lunch together, which might sound silly, but at the same time, it kind of forces everyone to put what they're doing down. We all get together and we all sit and, talk, whether it be about work or be about, personal life. And it just helps people to kind of better understand who's sitting next to them or who's sitting in the cubicle beside them, and to kind of have a little bit more of a personal relationship, which is important to me. And then the next example I have for you is from when I worked on the medical ICU. We started having a lot of turnover, which is, normal for floor units. That happens. I think it's kind of, one of those cyclic things. However, we just lost a lot of good nurses, and some that retired, some that just left and went to other units, and the morale was just incredibly down on the unit. And the attitudes were just horrible at work. And so, when I first started on this job, like everyone was such a team player and everyone really just, it was like a family. And all of a sudden that atmosphere just changed and something needed to be done. And, I kind of felt like, well, what makes people feel better? Well, a party. So I asked my manager if I could start the sunshine committee to spread some sunshine on everyone. And I started organizing lunches for the day shift, breakfast specials for night shift. And, if you wanted to bring food in, you could. Otherwise, I brought in a good amount of food for people to eat and snack. And, I did this a couple of times. And then I also, when you first walked into the unit, there was a huge window. And this is the way that staff came in the door and also patient family members. So on this window, I cut out a huge tree and then I cut out leaves, and this was the shout out tree. And this was so not only patient family members, but also employees could write on the leaf a shout out to someone else. So when you walked in, here you see this big tree and then you see all these leaves. And so you're coming into work and all of a sudden, you have to look at this tree. You can't look anywhere else. And you'll see your name up there. And somebody said, so and so, thank you so much for helping me yesterday, or thank you for helping me turn the patient, or for getting me my meds when I was, stuck in the room. I really appreciate that. And, it set the tone for your shift. You walk in and you're like, oh my gosh, somebody appreciated me doing that. It was so little, but it's so nice to be recognized. Um, you clocked in and maybe actually had a smile on your face. So this ended up taking off incredibly well. I had several other employees who came to me and said, I want to join the Sunshine Committee. So we went from a committee of 1 to a committee of 5, and then we started organizing after work activities. We did wine and design, dog walks at Umstead Park, and then we also did a couple of crafty brew nights, and then started holiday parties. And it was a great way then that it turned into ways for people to bond outside of work, which was important, especially because we started bringing in all these new employees to make to replace the ones that had left. And so, as a new employee, you don't really know anyone, and it can be very intimidating working with nurses. But now we had, reasons for you to come and socialize outside of your 12 hours, and it was great. I mean, all of a sudden now you're kind of speeding up the process of what sometimes can take as a long time for making and, developing relationships, but we are giving people reasons to come together and to hang out and find some common ground. And with that being said, the Sunshine Committee, I've now been gone from the ICU for over 3 years, but I'm happy to say the Sunshine Committee is still going very strong. So I think that those would be my two examples of how I was able to positively impact my teams in the past 2 units that I've worked in, and I think that shows that I do have a high emotional intelligence, because I can see when others are not doing well or things are not working out, and I can read others and be able to look at someone and say, okay, something needs to change, or something's not right. I don't just put the blinders on and, clock in, clock out and do what just I need to do. I'm much more in tune with, all right, how can the family work together and get things accomplished? This isn't just about me. It's about everyone. So hope that answers your question.
Is there anything else you feel would be important for me to know about your qualifications to lead and manage the medical surgical units?
I think that where I might lack experience as a true manager, I think I make up tenfold with my enthusiasm and my strong work ethic. I will not only be a leader, but I'm also going to be an advocate for my employees. I take on a hands-on approach. I want everyone involved. I want to know everyone. I want to develop a personal relationship with the staff and employees, and I think that alone makes for a great manager. And also, I understand, planning, organizing are 2 huge components of being a successful manager, especially when it's concerned with budgeting and making sure that, planning a successful fiscal budget. And I also, believe that continuing education is incredibly important, and I encourage others to do the same. So I'll be a manager who is not going to look down upon, my employees who want to go and further their careers, whether that be going to become a nurse practitioner or CRNA or get their master's in another area of nursing. I've, worked for managers who are not supportive. And to me, I think that you should always be supportive of continuing education, because that is what truly builds this nursing profession, is our willingness and ability to continually educate ourselves. And I think ultimately the only one that's, not only is it benefiting ourselves, but it's benefiting our patients. I honestly, I think that nursing is one of the greatest professions, and I truly love being a nurse. It's I can't imagine myself being anything else. And with that being said, I think that I would be an excellent fit for this position because of my enthusiasm and love for this profession and love for my other fellow nurses, and that I could, that I would really work hard to be successful and to be that advocate um, for not only these employees but also for our hospital. So I think that that is why I would make a great fit for this position. So,
All right, thank you.
well, thank you, and thank you for taking this time to interview with me.